there, this is Dr. Evan Osar with Fitness Education Seminars. Welcome to this edition of Fitness Insider, where we'll continue our conversation of corrective exercise strategies, Part 3, using visualization and imagery to improve posture and patterning. We know that visualization and imagery have been used extensively in practices such as yoga, Feldenkrais, and even the performing arts. And we know that athletes use visualization. For example, a golfer may use an image of thinking of a long straight line where he wants to drive the ball. He may think about the ball going into the cup before he takes a putt to improve performance. We know that dancers routinely use visualization and imagery to create the specific responses in their body that they want to do their dance performances. But more than just using visualization and imagery and the specific changes it creates in our body, it's creating a much deeper and more profound effect on our body. And that's why visualization and imagery are so key to our work that we do with our clients. For example, visualization and imagery activates specific patterns in the brain and can be added to enhance formation and long-term maintenance of new brain maps. And that comes out of the pelvic girdle by my friends and colleagues Diane Lee and Linda Joy Lee. And we know that we use these types of patterning to improve performance in the gym. So it's important to note that not only does it improve performance and create specific responses, but it's doing so at a neurological level. Everything we do with our clients is occurring at a neurological level. Yes, there's biomechanics that play a part and play a role in everything we do as well. But again, no matter what we do in the gym, whether we're stretching, strengthening, moving the body, we are creating neurological changes. And that's why the visualization and cueing that we use with our clients is so key to improving performance. And I'm going to share with you some of the strategies that we use that actually inhibit or prevent good performance by some of the cueing we use, and then show you how to use some proper cueing and visualizations and imagery to improve performance. So one of our greatest challenges is how our clients stabilize their body. So they present to us oftentimes with poor stabilization strategies, and these are often a result of how they habitually move from previous injuries, surgeries, traumas, what they've learned, even what they've learned from their exercise instructors, their coaches, and even their parents, who often cue clients or cue them to stand up tall, squeeze your shoulder blades down and back, squeeze your glutes, tuck your butt under. We hear these cues all the time. So you can see in my client in the image to the left, she overactivates her abdominal wall, so she creates this deep hollowing in her abdominal wall, and she overgrips her posterior hip, which creates a posterior pelvic tilt. And you see that pubic symphysis around here is in front of the ASIS. So she's in a posterior pelvic tilt, and when she goes into a squat, and she's not even squatting barely to parallel, you see she's already moving into a posterior pelvic tilt, and she's getting resultant lumbar spine flexion. And that's happening to so many of our clients because of these habitual stabilization patterns. And these are really overgripping patterns because of instability. Recall from a previous webinar that we get tight and experience tightness mostly as a result to instability. And we'll use gripping strategies to provide stability. And when we try to move into good movement patterns, such as a squat, we get resultant poor movement patterns. And then we also have a lack of balance. We have a lack of balance between the deep stabilization system and the superficial stabilization system. And again, this is not to suggest that these systems don't work together, but rather to suggest that the deep stabilization system has a specific response in the body, and the superficial system has a specific response in the body. And we'll talk about how cueing affects each of these systems next. So for our corrective exercise strategy checklist, we want to improve activation of the deep stabilization system. We want to teach integration of the deep stabilization system with the superficial stabilization system. So we'll show you specific cueing for both the systems and why, if you use a wrong cueing, it can actually lead to dysfunction. And then we'll show you how to integrate the function of these two systems and using visualization and imagery to perform and improve performance in higher level patterns and even activities of daily living. So the deep stabilization system. So if we're talking about the core, for example, we're going to talk about the diaphragm, the transverse abdominis, the multifidi, the pelvic floor, the deep neck flexors, the rotatories. So the muscles that help stabilize, and really their job is to decompress the spine, to create intersegmental stabilization and at the same time decompress the spine against the big pull or the pull of the big muscles, the superficial muscles. We can use specific cueing and visualizations by having the client think about being long. So she can visualize a wire pulling her neck long and pulling her tailbone away from her head. She can think about activating or breathing three-dimensionally. So we can think about a balloon filling up three-dimensionally to get her to use the diaphragm fully. We can think about a hoop-like structure to have her activate the diaphragm fully and create that thoraco-pelvic canister that we talk about quite often. We can talk about things like connect. So for example, we may want to keep her rib cage down as she breathes. So we want to have her think about connecting the rib cage to the pelvis. We want to think about imagining a balloon filling up the abdomen as you activate your transverse abdominis to create stabilization and still coordinate it with respiration. So again, we can use these cues, think about, connect, imagine, to activate the deep muscle system and coordinate that with proper breathing, three-dimensionally. The superficial stabilization system is activated much differently. Here we're going to think about the terminology like pack, so pack your shoulder, squeeze your glutes, or brace your abdominals. But it's important to remember, most clients don't have problem with this type of cueing. They don't have a problem squeezing their glutes. They're doing it all day long. They don't have a problem activating their abdominal wall. They pull their abs in all day long. So it's not the superficial system they have a problem with, it's the deep stabilization system. So using this terminology, brace, squeeze, pack, will just teach them how to use the system even more. And like I said, for most of our clients that are coming in with post-injury, post-rehab, post-surgery, they're already embracing strategies. So just getting them to brace more isn't the ideal strategy for many of these clients. And over compressing and over gripping leads to many of the direct problems our clients have and the early degenerative changes they experience because of this over compression. We can also use visualization and imagery to facilitate specific reactions. For example, on the image to the left, I'm cueing her to activate her deep abdominal wall. I'm cueing her to activate her serratus and lower trap by placing my thumb near her inferior angle of her scapula. So she thinks about bringing the scapula down and around the rib cage. I have her think about being long through her spine, like a wire is pulling her neck gently away from my hand. So she stays long through her spine as she activates. Then we can have her perform any number of patterns, whether she pushes herself up off the table, whether she uses a resistance band or dumbbell in her arm to maintain these activation strategies while performing now some additional resistance. In the image to the right, we can have her think about, again, being long through her spine. A lot of our clients have too much gripping around their hip, and that's what prohibits a lot of their good fundamental movement patterns of squatting, lunging, stepping, and even gait because there's too much gripping. We can get her to palpate the front of her hip and the back of her hip and think of the head of the femur being like a baseball, sliding back in the socket and moving back towards her backhand to get that femoral head to slide back in the acetabulum and not have her grip so much to push that femoral head forward as she comes up out of a split squat position. Many of our clients that are cued to squeeze their glutes are actually driving the femoral head forward in the socket, and that's where they get so many of their hip problems and groin pain and adductor strains because they're not having good centration of the hip joint. So this pattern and visualization of thinking about the head of the femur sliding back in the socket is a great way to get them out of these gripping strategies and get them to actually use their glutes the way the glutes are supposed to work and not just in a gripping fashion. Once we've done that, now we can teach them how to integrate it into the fundamental movement patterns. So for example, I'm going to have the client think about activating their deep core. He's going to think about keeping his spine long, and as he reaches forward, he's going to hinge. I'm going to asking him to think about a hinge and just hinging his hip or flexing his hip to bring his body forward, but maintaining a long spine. So he's always thinking about being long as he hinges forward. He can place his hands on his abdominal wall, both in the front and the sides, to ensure three-dimensional activation of the abdominal wall, and he continues to breathe as he goes through these patterns. So again, he's thinking about being long and maintaining activation and creating that hip hinge. And again, with many of our clients, we give them one of these things to think about at a time, because we can overwhelm our client by having them think about all these things, have them think of one specific reaction at a time. If they have trouble staying long, have them think long. If they have trouble activating their core, have them activate their core. If they have trouble understanding where the hip hinge is, teach them how to think about the hip being a hinge. So again, don't overwhelm them with too many cues. Give them the most appropriate cue for what you're trying to improve in their patterns. So conclusion, we can use visualization and imagery to improve function. But again, we have to use the correct strategy and the correct cueing to get the right response. As we talked about, too many of our clients are presenting to us, especially our general population clients, with too much gripping already, especially if they've learned training and or posture by tucking under, by squeezing the shoulder blades down and back, by overactivating their abdominal wall. They already have too much gripping strategy already. If we teach them specific cueing like thinking long, connecting, lighten, move more slowly, we can get them to have a better overall balance between the deep stabilization system and the superficial stabilization system. And then we have to teach these clients how to use these systems together to perform fundamental movement patterns, and teach them and cue them how to even incorporate these things into their activities of daily living. So when they bend over, have them relax through the hips, have them relax through the abdominal wall. They don't need to brace when they're doing low-level activities, unless maybe they're in pain. Then you may change your strategy. But again, having the most appropriate strategy for the task at hand. They don't have to grip all the time. They don't have to squeeze all the time. They don't have to brace all the time. And many times we have to cue our clients out of these strategies to improve their performance. This is Dr. Evan Osar with Fitness Insider. I hope you enjoyed this webinar. If you enjoyed it, feel free to pass it on to your colleagues. Catch us next time, where we'll talk about part 4. How do we put together this corrective exercise strategy to improving performance and helping you serve your clients better? Thanks for tuning in. We'll catch you next time here at Fitness Education Seminars. Take care. Have a great day.